Good morning to everyone and all of our early risers today. Welcome back to the Tundra. We'll get started at about 8:32. So if you want to grab some coffee, get a morning snack, go ahead. Also, Google Meets has decided to change overnight on me. So we might have to do a little bit of tinkering to get everything to work out. But we'll get started at 8:32. Thanks. Good morning again to the folks who have just joined. Just a reminder, we get started at 8:32 this morning. We give everyone a couple of extra minutes. It's a little bit of an early meeting. There's a tundra outside, all kinds of fun things happening. So we'll get started at 8:32. Thanks. Okay, good morning, everyone, and welcome to the February Child and Adolescent Wellness Work Group. Got some exciting things happening here today. We have Fred and friends. The whole crew is with us this morning. We'll get started here in just a minute. I'm going to pull the agenda up. And I'm going to screen share that. Google Meets is doing something new. So if anyone has any issues, hopefully you'll be able to put any questions in the chat. It looks like we have to kind of move people into the contributors zone if they want to actually be in the main screen. So I may have to do that if we have some questions or do a Q&A here later this morning. Looks like there's all kinds of fun features. I can flip cameras and audio on and off. I won't do that, but those are there now. Things change overnight. So let's go ahead and look at the agenda for this morning. Give me just a second. Okay, and hopefully everyone can see my screen here. So this is the February meeting of the Garrett County Child and Adolescent Wellness Work Group. Just as a reminder, getting started here, the presentation series overview and request for presenters. So we'll kind of go down through the agenda. I just want to remind everyone, these meetings are recorded. They are posted on the Garrett County Health Department website, and I'll show you where that's at here in just a minute. And our goal is really to try to create a little bit of a greater utility with some of the materials that we create, having folks come and present about their programs, kind of explain some things, have a Q&A session so that people can really interact with whatever the topic is that particular month. And I think we've had some really good presenters. I know that I really enjoyed WIC. I enjoyed the presentation we had last month. And we've had a lot of really good information that has been shared. So hopefully we'll be able to kind of continue this series. If you want to present, I always invite folks to just reach out to me or Beth Brenneman. We are fortunate, I believe, to have the great Beth Brenneman with us this morning. She keeps track of all of our notes. There she is. All my screen has moved around as well with Google Meets. So she keeps track of all of our minutes. She sends out all of our invites and really helps facilitate this whole process. So thank you, Beth. And as I said, the presentation series is open to anyone. So anyone who wants to present a topic that helps promote child and adolescent health and wellness. So either email me or Beth. We'll get you on the schedule. We do have some great content coming up that I'll explain toward the end, kind of tied in with Shelley's work and the assessment and the community health improvement plan, and how we can kind of utilize that as a springboard to get us a little more relevant data, a little more recent data. And that's always kind of been a focus of this committee. So in addition to the presentation series, we want to make sure we're looking at data, want to make sure that we're well informed about what the priorities are for that population, and also what the secondary data tells us about that population in terms of demographics, in terms of health concerns, in terms of access to services, access being a huge piece of the assessment this cycle. So we'll go ahead and just kind of move forward here, but that's just a reminder, email me or Beth if you'd like to present. And these are utilized. So we do, and I see some folks are getting kicked on and off the meeting. Apologies, I don't know what's happening with Google Meet this morning. So just keep trying to get back in. We will post the recording so that everyone has access to it. But hopefully we'll be able to utilize these in a few more ways. So we'll go ahead and get started this morning. We have a presentation on the Garrett County Local Management Board and Garrett County Local Behavioral Health Authority, presented by Sadie Liller, Lindsay Broadwater, and Katie Shadell. And to get started here, let me stop presenting here for 1 second. I'll go ahead and have everyone introduce themselves, and I'll go ahead and popcorn it off here to Fred, and then Fred can continue that chain. So Fred Pulse is the director of the Garrett County Local Management Board and the director of the Garrett County Local Behavioral Health Authority. That's a lot of titles, and most people know Fred, but Fred, do you want to introduce yourself?
Not really, John. You did a rather okay job with doing that.
Just an okay. Okay, then pick someone else, Fred. Popcorn it off.
Oh my gosh. Okay, we'll go with Lindsay Broadwater.
Hey, I'm Lindsay Broadwater with the Garrett County Local Behavioral Health Authority and Local Management Board Office, and I will hand it off to Brianna.
Good morning. I am the accountant and the fiscal person for the Local Behavioral Health Authority and Local Management Board. And go ahead, Katie.
Good morning. I'm Katie Shadle. I'm the program coordinator for the Hub. And go, Sadie.
Good morning, everyone. Sadie Liller. I am the Adult Services Coordinator for the Local Behavioral Health Authority Local Management Board. And I will pass it off to Amber Martin.
I think with the new Google Meets permissions, we'll have to give everybody contributor access. Jillian, do you want to introduce yourself real quick as the last core member there?
Yeah, sure. I'm Gillian Shreve. I'm the Office Secretary for the Local Management Board and the Local Behaviour Health Authority.
I'm sorry, Jillian, you've been away for so long, I forgot about you. I'm sorry.
I'm giving everybody permissions here. So go ahead and get started with your presentation, whoever wants to kick it off.
I'll go ahead and screen share it if that's okay with everyone. And then Sadie, I think your slides are first, if I remember correctly. So
Yes.
I'll get them up for you and then you can go ahead.
Okay.
Did those share? Or do I need to try something else?
No, they're not up yet.
They're not sharing yet. Give me just a second. I've made you a co-host, Lindsay, so hopefully you can share it now. There's like 6 new levels of permissions.
There we
Okay,
go.
that's showing up.
Okay, good now?
Yep. Okay,
perfect.
Lindsay, will you advance to the next screen, please? Slide. Okay, the Garrett County Local Behavioral Health Authority. We are the management agency for the publicly funded mental health and substance use related disorder services. Our agency strives to improve these services to residents of Garrett County. We work to better integrate existing services and to expand services currently available. We also assist persons in receiving medication, transportation to services, housing, and employment. And we are funded through grants from the Maryland Department of Health. Next slide, please. Okay, so to be eligible for these services, the individual has to have a mental health disorder as defined in the DSM-5. The individual must be a Medicaid recipient. An individual is dually eligible for Medicare but remains in Medicaid fee-for-service system. An individual is Medicaid ineligible and because of psychiatric and financial need may be able to have the cost of mental health services in whole or part subsidized by the state and or local funds. Next slide. Tag, you're it.
All right, so I will share a little bit about the Garrett County Local Management Board. And John, thank you for this opportunity because I think that a lot of people don't quite know what our office does, and that's okay because it's kind of a whole lot. So the Local Management Board side of things, and Jillian, Fred, Brianna, anyone else, feel free to jump in if I miss anything important. But we receive funds from the governor's office for children who sets priority result areas and indicators. So result areas like all babies in the state of Maryland will be born healthy, all children in Maryland will be healthy, all children in Maryland enter school ready to learn. And then we, of course, focus on the Garrett County portion of the Maryland residents. So the LMB, the board, reviews data related to each indicator and compares that Garrett County data with other Maryland counties that we are comparable to and the state averages. And then the board, utilizing that data and community feedback, we like to hold some community feedback sessions and some open discussions. They choose result areas and indicators to prioritize that they then make their funding decisions from. And aim to impact those areas. Down here is a link to our My Garrett County page for our group. So if anyone's interested in looking at any of the specifically funded programs or the results and indicators that we are currently working on, or once we choose new ones, they will be on there as well. So currently in fiscal year 25, the Garrett County Local Management Board funds these programs, and then the 7 community supports activities as well through the community partnership agreement. We are looking forward to receiving our fiscal year 2026 community partnership agreement soon, with possibly new results and indicators that the Governor's Office for Children will be prioritizing potentially. So the local management board will go through those and pick new priority areas as we do every year. And then choose programs and community support activities to fund for the upcoming year. But these are the currently funded programs and community support activities. And I also wanted to touch a little bit on the local care team, which is kind of a big thing that the local management board side of things does, and the local behavioral health authority is involved as well. But the LMB is the neutral convener of sorts for the local care team, where we gather an interagency council with all of the partner agencies listed there to provide support for families who are referred to the local care team. They can also invite any support people that they would like, any additional agencies that they are involved with, anyone who might have some good background information on the family, or just provide support for the family to get them through these emotional, educational, mental, or legal issues. Sorry for the loudness in my house right now. And that is all I had on the LMB, if Katie wants to go ahead.
Yeah, definitely. Thanks, Lindsay. So we have a new program. Well, it's been going on for about a year now, but we just submitted a new grant proposal for the Coordinated Community Supports Partnership. I know that some of you have probably heard about the Hub. It serves as a central point of connection, linking students and families with essential behavioral health services. Streamlines access to care, ensuring that students receive the support through collaborative partnerships with local education agencies, service providers, and community organizations. We focus on a streamlined referral system, needs assessment, and then consistent communication and data-driven evaluation. The Hub strives to improve student well-being, enhance family support, and build community capacity for behavioral health. Our overall goal is to create a healthier and more supportive environment for all. And then I only started about a month ago, so I thought that this visual of what the Hub, our service providers are called spokes. Right now we have, for fiscal year 25, we have 4 spokes. And then we at the Garrett County and Allegheny County Local Behavioral Health Authorities are the Hub. And then all together we form the Coordinated Community Supports Partnership. So it took me a little while to visualize that, but now that I've seen this, it makes it a lot easier. So I was hoping it would make it easier for everyone else too. And I think that that was all I had.
That is the last of our slides. So Jillian, Fred, Brianna, if you have anything to add, since you didn't get your own specific speaking slides today.
I don't have anything to add, but I think that you all covered what our office does very well. And of course, this is just a broad overview of everything we do. There's so much that goes on with each individual program, with the LBHA, the LMB, and now with the Community Supports Partnership. But these girls work really hard, and we're lucky to have each of them.
Says our contract, fiscal, and monitoring expert in the office. Brianna, thank you.
Okay, well, thank you for that fantastic presentation. That was way more than I was expecting, because I totally sprung this on them at the last minute because I was looking at our schedule and realized that we needed to move someone in the middle here for presentation series. So thank you so much for that. Please, Lindsay, if you can send me a copy of the slides, I would like to post those with the recording as well. I really love all of the explanation that you guys gave, particularly the hub and spokes model, because I have had to explain that a few times, and I feel like I have never been able to explain it that well, and I think that that is a fantastic slide. Oh, thank you, Lindsay. So we'll go ahead and kick it off to Q&A. So it's a great opportunity to ask any questions, seek answers. Even if you might already know the information, it can be really helpful if it's something that you feel like is uncommon, something that you would like to have recorded so that other folks will be able to hear it when they go back and watch the recording. We are going to kind of ramp up the marketing a little bit with this, now that we've kind of had a couple of these presentation series built up. So I will show you that after we do the Q&A, where you can find these, how we're going to use them. We'll talk a little bit about that. But does anybody have any questions or answers for Fred and friends? Okay. Well,
John, this
yes.
is Sadie. I just had a message from Chelsea where she can't unmute or write in the chat.
Let me see here real quick. Chelsea. Let's see here. Okay, we're gonna have some more co-hosts. Give me just a second. Chelsea, can you talk now? Well, Google Meets is doing something odd, so if Chelsea's able to join us, we will try to do that. If folks,
She said she still can't, so.
John, when I logged in, it made me accept the ability to be a contributor, which has never happened before. So I'm not sure if there's some weird setting on the meeting.
yes. Okay, Leah has a question. I'm looking at Chelsea. I'm going to try to see if I can fix Chelsea's. Let's see here real quick. Leah asked, how do organizations become partners with the LMB?
So I guess, Leah, that kind of depends what type of partner you're thinking of. The LMB is, like I said, kind of the neutral convener of all, child and family services. So the LMB loves to partner with agencies and kind of be aware of what's going on and push out those services that are available. So but if you have something specific in mind, and you want to get a hold of myself or Fred or Jillian, or any of us really, we could talk about, whatever you have in mind. Fred, do you have anything to add to that?
Yeah, thanks, Lindsay, for sharing that. And that's a wonderful way to talk a little bit more about partnerships. So what can happen if it's when the community partnership is released, what we've done, I think what we started last year is we had community feedback sessions or listening sessions. And what that provides is an opportunity for organizations and the general public to see what the prioritized results are or have been in the county, what the data is showing, and then help the local management board make decisions on what to prioritize for funding initiatives for the upcoming fiscal year. And so it's a very similar concept to the manner in which Shelley and John did the community health assessment, with doing the surveys and then having very specific community-based focus groups. And so that seems to be the most helpful and beneficial way to get feedback other than from what the state is telling people to prioritize. And it allows to have some more genuine and spontaneous feedback from community members, even if some of those community members might be in organizations that could benefit from some of the funding options that are available. So there's a lot of different nuances within the results-based accountability approach that we use, and also with the prioritized result areas that the Governor's Office for Children has set. I believe they still have 8 of them, and they have indicators within those result areas that are supposed to be population-based, where it's, and I think Lindsay mentioned this before, it's kind of like reducing childhood hunger. And so it's not specific for just Garrett County, it's for every child in the state of Maryland. And so what we would do locally then, and some of the programs that currently the LMB funds, identifies that as an indicator for the funding that they receive. And so then the service providers are expected to do very specific initiatives to directly relate to the overall goal of reducing childhood hunger. And so it doesn't mean just providing snacks. It would mean working with the family members or care providers, for example, to educate them and then provide some cooking lessons if the program has that capability or that capacity. And so some of that stuff, and I don't know if there's, I don't know if Shelley, I think she's still with us. She might talk about that a little bit with the upcoming food bank program and process that's occurring in the county. And so some of that will then dovetail directly in with some of the results-based, or the results that the Governor's Office of Children has, and also that the local behavioral health authority part of our office has regarding mental health and wellness for residents of Garrett County. So thanks for that question, Leah, and there'll be opportunities to provide some feedback. And if people would like to or be interested in presenting to the local management board, you can let Jillian know. She develops the agenda, or let anyone, as Lindsay referenced earlier, and we can set an opportunity up for people to talk about the services that your organization or agency provides and how you believe you might be able to help residents of the county at all ages to address some of the prioritized result areas that are identified for Garrett County.
Thanks so much, Fred. I appreciate the information.
Okay, that was a fantastic question and a phenomenal response. I'm really glad that we have that recorded, because I don't know that I could ever explain it that well. So thank you, Fred. It looks like there's a few people who are still having issues. So you might be able to use the chat button down in the bottom right-hand corner of your screen. If not, there might be a Q&A button down here. I've enabled all of the options to try to give people opportunities to ask questions. Does anybody else have a question at the moment? Okay, while we're waiting for questions, I'll go ahead and ask one, and I'll open this up to the group. So you mentioned that you have a lot of programs, obviously, that fall under your bucket. So there's a lot of things that you fund. You have oversight over certain programs. Where can people find the data and information for those programs? Can you talk a little bit about that, and where they might be able to dive in and see some of the impact and the results that come from the programs that you either directly fund or have some sort of involvement with?
So for the LMB side of things, each of the programs that the local management board funds has their own mygarrettcounty.com page. So if you search the program name, you should find their page, and they do report all of their performance measures, at least on a quarterly basis there, and give a little bit about the impact that they're having. The local management board itself has some performance measures that we report on there as well, and the local care team, so it has its own separate mygarrettcounty.com page. And then Sadie, if you want to share a little bit about the local behavioral health authority.
Yes, thank you, Lindsay. We have My Garrett County pages as well. The local behavioral health authority has one specific to what we do. We share things on there about upcoming trainings and different things that we do.
I'll also add to that the programs that we fund and that we contract out through the LBHA, they are also required to and are supposed to do reporting on the mygarrettcounty.com as well. So they should have some data over there that can be found.
And I'll come back and also add that the Governor's Office of Children uses Clear Impact Scorecard. So if you would just search scorecard, and we report the same performance measures to scorecard that you would find in mygarrettcounty.com. It would just be another site that you could find that data.
Thank you all. See what I did there? I already knew the answer, but I asked the question. So we would have it. But I think that it is important to have that information. You know, data at the moment does appear to be at a premium. So being able to have that program data to be able to kind of look at the impact of all of your programs, I think is really important. So are there any other questions before we kind of dive into a little bit of a roadmap for the CHA? Okay, I might need to keep giving people permissions. I'm not sure what is happening with Google Meets, but it's fine. This has been great. We're still moving forward. So I'm going to go ahead and switch. If anybody thinks of anything in the meantime before the meeting ends, you can put it in the chat, or you can raise your hand, or just come off of mute. And while we have all of this, all of these fantastic folks, we can ask those questions. So I'm going to go ahead and jump back to the agenda here real quick. Give me just a second. Okay, so hopefully everybody can see my screen. So that was our Q&A. Next up is data roadmap and updates. So most of you, probably, hopefully all of you, should have received an email announcing the launch of the new community health assessment. It's a major project. It's over 3,000 pages, all kinds of applications, tools, data sets, separate PDF reports, XYZ. We do all kinds of things with the community health assessment. Thank you, Sadie. And I'm just going to show you guys where you can access this. I'm going to close that. It's important to know where our work is being used and how we can better inform future versions of it. But if you go to mygarrettcounty.com and you hover over my community, you can go down to the community health needs assessment for 2025 through 2027. That's where you will find the community health assessment. You can also see the process. So kind of a very transparent way of how we work through this process, how each of these individual components came to be, looking all the way back at the groups on My Garrett County that we looked at, to the primary data, to the survey instrument, to the focus groups. A lot of information is available in there, but you can also see all of the historical records dating back to 2016. So you can see that we are now on the 4th iteration of the new community health needs assessment process. There's also the community health improvement plan and all kinds of other tools, including an open data warehouse. There's a lot of broken links there at the moment, and so we'll just kind of have to wait and see what happens there. But the community health needs assessment is a great resource because it has all the PDFs and static copies of data, and all of these are very, very fresh. These were all just taken within the last couple of months, so hopefully this will be more than enough to get us through for a while. Shelly, who I believe is with us, she was with us, but hopefully she didn't get kicked off with all of the things happening with Google Meets today. But the Garrett County Community Health Needs Assessment, this is what it looks like. You can see there's all kinds of tools here. Oh, Shelly is here, so I'll kick it off to her here in just a second. But I just wanted to make sure that everybody knew that this was here. Shelly will be presenting this at Health Planning Council this month, and hopefully in this committee, in this group, what I would like to do is then, once this is presented and folks have the opportunity to ask general questions about the data, we can take a little bit of a deeper dive, look into some of the priorities that were set by the community, kind of take a look at the secondary data that's available, look at the SHARP, the Community Health Assessment Research Portal, and a couple of these pieces at Health Planning Council. Hopefully at our next meeting, we'll have a chance to dive into this a little bit deeper, and we can kind of segment out some of this data, and we can say, okay, well, among adolescents, so the under teen age population, because there's a lot of nuances for how we can collect data for folks under the age of 18. We can kind of look at that bucket and see, okay, what were their priorities that they identified? And we've done this a couple of times. We did this back at the instantiation of this group with Dr. Schwam and Dr. Quarter, kind of looking at the status of health, looking at the poor uptake of child well check visits, and then also for child maltreatment. So there's a long history of utilizing data within this work group, and it's been a couple of years since we've had really good up-to-date data that we could kind of look at how this compares across our primary data, our secondary data, and all of these other resources. You know, during the pandemic, there were a lot of challenges, but this is really a great resource to kind of get us back on track. It's very extraordinarily comprehensive. It was all I could do to read back through it as we were putting it together before we published the final version. But there will be a lot more to come with this, and I just wanted to make sure that everybody has access to this, so that you can kind of bring your questions to Health Planning Council. You can bring questions to our next meeting, and we'll really try to look at, you know, where does the data lie, both primary and secondary, with our child and adolescent populations and the people who take care of them. So hopefully we'll get to that. But I'm gonna go ahead and kick it off to Shelly and see if she has anything that she wants to add. Shelly, hopefully you can. Speak.
Can you guys hear me okay?
Yes.
All right. I think I have permissions. That was a wonderful overview, John. Thank you so much. I think to tie it back into the assessment, to back into the topic for today's meeting, and thinking about the food bank / resource hub we're standing up, I was able to utilize all of our new assessment data, especially the secondary analysis report, to get a really nice array of food insecurity data, food deserts, things that relate to poverty. And as we work together to really put applications in and justify the need for a food bank and a resource hub of that nature, that's where I got all of the data. And having it in one place and it's all up to date is a really wonderful resource for all of us as we work together to seek grants and seek funding opportunities. So, and also to help us tell the story, right? Because we need compelling data to be able to talk about what's happening in our community. So that's just one really great way to do that. And I'm looking forward to working with you all to figure out kind of the direction and what else is in there. Like John said, it is exhaustive, but that's helpful. And this is the first year that we've been able to go into zip code data in the way that we have it in the assessment. So I think that it's just a good resource for us, and hopefully we can all kind of share the way that we're using it. So that's all I have. Thanks.
Thank you, Shelly. And as I mentioned, you can see her wonderful presentation at Health Planning Council, where she'll go over all of that, and folks can ask questions. It's always a really good interactive component to kind of tie off that process and then kind of kickstart what happens next with the community health improvement plan and all the ways that we will try to utilize this in this work group and other work groups and committees. We'll try to kind of incorporate this data. So that is the meat of today. We went over the presentation. We had our data roadmap and updates. Before we go to agency updates, I just want to give one update on the resources from this committee. So one of the things that we've been trying to do is really figure out, you know, how can we have a bigger impact than just the folks that are able to join us? Because I know that the time slots are hard. We've had probably 20 different doodle polls over the years trying to find the perfect time for all of the providers and all of the agency folks, and you know, getting everybody on here at the same time is still a challenge. I had a couple meetings over the last month and a half with folks from particularly some of the provider offices that are still having challenges with the times. I think at the moment this still is the best time. You know, we've surveyed, we've asked folks. This seems to be the line of best fit. But we want to make sure that these are recorded, that they're posted. Beth does a phenomenal job keeping track of all of the minutes, so that those are available for people who just kind of want to skim it and not watch an hour-long video. I think that's an incredible resource as well. But I'm going to just screen share here real quick so that you can see, because we are keeping all of these these posted in public so that people can see them. So if you go to the health department's webpage, it's just garretthealth.org. Under news, you can see events. And I'm going to try to do a little bit more with this once we have a few more recordings. But it is right here at the moment, Garrett County Child and Adolescent Wellness Workgroup. So if you click on that, you can actually come down here. You'll see this full page. You can also search for it on our website. The search works very well. A lot of folks use that in order to find resources because the health department website is very, very big. It's probably the biggest website I've ever worked on. We have a lot of programs and the programs change. So we have a lot of history of programs as well. But this is the Garrett County Child and Adolescent Wellness Workgroup webpage. You can see my contact and Beth. So you can reach out to either of us. We really would like to have some more presentations. So if you are interested in presenting or if folks at your agency are interested in presenting, love to have that. Love to get them on the schedule so that we can kind of continue this series and have some of these resources available. I found several ways, like I said, in particular, the WIC presentation. I've been able to utilize that when people are like, you know, how does WIC actually work? So having some of these resources available, I think, is just really phenomenal. So you can see the last 3 meetings. We're just kind of moving forward from November of 2024. This meeting will be posted here, assuming that Google Meets hasn't done something else new that messes up the recording. But you can see the November meeting, which was Garrett County WIC, the December 2024 meeting, which was Shelley presenting Healthy Together, Karen presented for Garrett County WIC, and then what we had here in January, a really great presentation again, information on the Child and Adolescent PRP program. So the Garrett County Local Management Board and Garrett County Local Behavioral Health Authority, it's like a whole paragraph there, will be here. And we'll just kind of continue to keep records here so that folks can access it. We'll try to post presentations. So as those become available, we'll try to make sure that that's in here as well. I really appreciated everybody, you know, who came on this morning from Fred's office to provide really good information. But that's where you can find this. So I'm going to go ahead and kick things back over here for anyone who has an agency update who is able to interact with the meeting this morning. Does anybody have anything? Just go ahead and start. Come off mic or put it in. Oh, okay, Amber, go ahead.
So as you know, May is Mental Health Month and also Children's Mental Health. And we are doing a color run walk on May 17th at the Glades. And we are working with Sadie and Leah at Maryland Wellness. St. Paul's has made a donation to our child and adolescent program. So they are helping fund this, and we have our own monies as well. We're hoping to have bouncy houses, the color run walk, games and stuff outside. So we're in the process of planning that. If anybody would like to set up a table, we do have a flyer that we will be sending out, that any organization that works with children or their families that with mental health, we would like you to set up a table there with us and with your brochure information to get your information out as well. We want to work together with everybody to be able to help kids with mental health because it lacks in our area so much. So if you have any questions, feel free to call me. I'll put my name or my phone number and email in the chat. Please reach out if you have any questions. If you want to participate, we'd love to have anybody involved with us. So yep, we're doing that in May.
I'm going to go ahead and chime in with that, Amber. I didn't hear you saying that there's going to be food provided as well. And this is the 2nd annual one. So we're hoping to make it bigger and better than it was last year, hence moving it over to the Glades. So I appreciate the partnership with Lighthouse and doing this. I think it's going to be a really good event this year.
I do too. I think we have got some great ideas, and it will be free. There's no charge for anything. We will take care of all of that. We just want kids and their families to be able to come out and enjoy a good day.
And there's going to be a table set up at the health fair too.
Yes.
with information about the Color Run Walk. And are there going to be waivers for them to get paperwork that day to fill out beforehand, Amber?
I don't know. We could probably discuss that at the next meeting because we forgot to bring it up in the meeting. So we'll figure out if we want to do that there or if we want to just wait until the day of. We can figure that out there.
Okay. All right.
Did someone else have a question?
No, I just have stuff to report from WIC.
Oh, okay. All right. I'll let you go.
So US government came through and they have authorized that WIC can change up the food package. So very exciting. We will be able to offer some plant-based milk, more culturally appropriate foods. So Caroline and I spent quite a few hours going out to the stores, making sure that our stores had these provided foods. So hopefully by October, the change will be made. We're keeping our fingers crossed. But if not, then sometime in the near future. We also opened a client portal, so new participants can make appointments through that. It pops up in our screen, and so can already current participants do it. So far, we've had one participant use it. It looks like it's going to be a great tool. But that's what I have for WIC so far. I'll keep you guys updated on the food list.
Yeah, Cindy, go ahead.
I don't have any questions about that, but I have an update as well. The next Trauma Informed Care Summit will be Tuesday, May 27th, 2025 from 9 to 4. It's going to be at Garrett College at the Performing Arts Center. Registration is still open for that. Needs to be done by Friday, May 9th. Last time we checked, I think we had around 80-ish participants, and we can take up to 120. So if you're interested, please get registered for that. It should be a good workshop. And Amy Merrick is coming back. She does a really good job presenting.
One more thing, if you know any pregnant mamas, Judy Center is holding their annual baby shower on April the 2nd. If they live in Broadford and Friendsville, their baby shower will be from 4 to 6. If they live Yacht Glades or Grantsville district, they'll be from 6 to 8. And it takes place at the Garrett County Performing Arts Center. If you've never heard of it or been to one, really cool. They get to pick a big gift at the end, like a pack and play or a bouncer. And then community agencies come together, excuse me, I can't talk this morning, and give out diapers and blankets. It's really neat. And there is no, as far as I understand, there's no income guidelines for that.
James, hopefully you can see.
Give it a shot here, John.
Yeah,
This is James
thanks.
Frank with the Garrett County Health Department, Health Education and Outreach Department. I just wanted to let everyone in this meeting know that we are going to host Keeping Your Kids Safe and Healthy at our Partners After School program. We're going to call this, it's like a prevention education fair. And we are looking for some special speakers or for different community resources, people that could set up some tables that could help the participants and families of our after school programs here in the Oakland area. So if I will send this flyer out to everyone that's in the meeting, or ask John to do that for me. If you are interested in having a table set up there, or you would like to speak at this engagement or another one that will be hosted at the north end, I would appreciate you just reaching out. So we'll get the flyer out to everyone, and anyone who has questions or wants to participate, please reach out to me.
Thank you all for the updates. I've been making notes of all the things that I need to remember. I will definitely circle back around with you, Karen, on the WIC portal, and then for Sadie and Lindsay, I see that you also put a comment in the chat. If you'd like me to send the Trauma Informed Care Summit information back out again, I think that would probably be good as well, because I think that is a really important event. And then James, I think that that's a great opportunity. If I can help with that in any way, definitely let me know. And then we can also make sure that somebody can put that up at Planning Council too. Yeah, go ahead.
Absolutely. Thank you for those that already responded back. I will be reaching out within the next 24 hours.
Great, love that. So I'm going to give a quick update here as well for the health department. So let me just screen share again. I want to remind everyone, because I know that a few folks have unsubscribed, and we do have tracking on our emails, so I know who you are. But if you go to the health department's website and you scroll down on the homepage to this blue box right here, and thank you for the laughs, this blue box right here that says subscribe for email updates. If you're not getting an email from me Monday through Friday, pretty much every morning, we miss a couple days when we get a little bit busy with meetings, but for the most part, you should be getting several emails, like one each morning during weekdays, sometimes on Saturdays as well. But there's this box here called subscribe for email updates. If you don't get those, please put your email address in there. If you have staff that you would like to be informed about programs, please make sure that they put their email addresses in there. We do try to keep people subscribed through however they be reaching out to us through any of our programs, through agency level efforts. But obviously, sometimes people unsubscribe, and I understand, but there's a lot of really important stuff happening at the moment. Definitely a lot of events really starting to pick back up again. I'm super excited to see what happens with Amber and Sadie and all the folks who are planning that. There's quite no one who puts on a community event like Sadie, so I'm sure that'll be a blast. But I just wanted to remind folks that this is here. So if you unsubscribed, you can resubscribe yourself. Or if you have people who are new, people who just aren't getting the updates, you can put their emails in there and they will get that. So it's a digest every morning that we post an update with the most recent information. And generally, we get pretty good click-through rates on that. So I think that it is valuable information. I've cut it down. It's no longer twice a day. I know that was a lot. It's now just once a day. But we generally do publish at least one or even several things a day. So it is helpful to keep everybody informed. We're doing a staff survey at the moment and kind of looking at some of the comments coming back in. And, we continue to see that communications are something that we want to focus on, and making sure that people are well informed, know what's going on. And this really is the best way to do it, because nothing goes out on our social media or goes anywhere unless it's included in this digest. That's how we do all of our record keeping. So it has to go out through this channel. So if you subscribe, you will get those emails and you will have those notifications. The other thing is that we do have an events calendar here, so you can kind of see some of the things happening. Shelley has all kinds of events. Health education has some really great programming that's going to be coming on board. We're working on a new overdose response brochure that should be available soon. There's also some tobacco cessation classes that are beginning to. Hopefully everybody can see my screen. Google's doing something odd. But there's some quit now tobacco cessation classes beginning. There's a youth pickleball clinic. There's all kinds of stuff happening. So we really want to make sure that people are well informed, that people utilize the resources that are available. And then the last thing I said, I just want to mention down here was that we just launched our local store food voucher. I'll let Shelley talk about that a little bit, but we are continuing to see a lot of need for food security. Obviously, there's a food bank meeting that was incredibly well attended. There will be a press release coming out about that today with some additional information follow up. But this continues to be something that we just kind of see continuous and unfortunately continuously increasing need for. So we launched our food voucher program. We initially started with 50. Those sold out in under 3 hours. About 2 hours, we ran out of the first 50. So we expanded it. We are now going to do 100 at our first event in Grantsville. And we are now sold out of those as well. So certainly, that is a need that we see, and people are driving from far far distances really across the county to get some of these resources. So it's certainly something that we're going to be really looking at the data, analyzing it, and trying to figure out how we can continue to kind of fill the gap until some of these broader resources come on board, because it does take time to do all of this. But thankfully, we have incredible partners. I saw that Lorena was on the call. Hopefully she didn't get kicked off. But there's several people who are really involved in this food work. Fred's office, the local management board, has provided some funds to really put some stopgap efforts in to do a little bit of kind of a learning project to really figure out, what does the food security system need to look like? Because that continues to be a threat across all of our programs. We have the fantastic folks in WIC that have been doing that. We have great folks at DSS that I don't think were able to join the call. They may have tried and just couldn't get in. I don't know what's happening with Google Meets, but certainly food security is something that we're spending a lot of time and energy trying to figure out, but also looking at how it kind of cross cuts through our programs, because it does appear to be something that's going to need a couple different methods to address. So Shelley, do you have anything else that you want to add from your perspective? Oh, and real quick, I see a comment from Jamie. Okay, thanks, Shelley. So Jamie said she's trying to submit some of these events to town. Thank you, to town newsletters. It absolutely is possible to get all of these resources. So if anybody, I'm going to put my email in the chat, but I can certainly add folks when I'm sending all these out. So Susanna Ziegler, or Susanna Sisler, sorry, Susanna Sisler is our social media coordinator at the health department. So when I send those out to her, I can also make sure, Jamie, that you and anybody else that you would like to have copies of those can get copies of those as well. So when that kind of kicks out through our email, and then it then kicks out to Suze, and then she puts it on our social media, we can certainly do that as well. But those are just a couple of the updates, and I think that that's something that we still have to figure out kind of post-pandemic, is getting back in the rhythm of things. I think it takes a lot of effort, a lot of energy to really make sure that we have all of our bases covered. So I really appreciate that, Jamie. I'll definitely be in touch with you, and I'll put my email in the chat if anybody has any questions or anybody wants any extra resources from the health department. So any other agency or just community updates, doesn't even have to be from an agency.
John, I'm wearing my Board of Ed hat now. There's going to be a vaping presentation at Southern High School on the 25th of this month. I believe the time for that is 5 o'clock or 5:30. They have a speaker coming. You can go to the Board of Education's website for more information on that. But with our vaping rates being so high, I urge parents to come out for that. I know they're going to be having the presentation during school time for the students as well. So I think this is a great opportunity for adults to come out too.
Sadie, I have a quick question about that. At the presentation, will there be any type of cessation or any type of help if people or information about people who want to quit or ways to quit, like maybe from James' unit or something? Just thinking about trying to tie everything together and make sure we capitalize on the people that are there.
That is a great question. I haven't heard anything like that. I can reach out to the school and find out. I don't know if Chelsea's still on here, but maybe James can ask her. Are they interested in having information there or set up a table there? If they are, let me know, and I will reach out to the school and Dr. McCartney to make sure that that's appropriate and they'll allow people. I think that's a great idea.
Yeah, I will definitely follow up with that. Shelley and Sadie both. If Chelsea is not on this meeting, I know she was here earlier, but I will reach out for sure to Chelsea and to Alicia Martin, who is the tobacco coordinator for prevention efforts. So yeah, that is a great idea, and I will see what I find out, and I will just have them follow up with you, Sadie. Is that okay?
Yeah, that's fine.
Okay, thank you.
Thank you.
Thank you all. I think that that's a great coordination piece. And Chelsea was trying to speak. She kept getting kicked off. I kept trying to give her permissions. She did message me, and we just couldn't quite get it figured out. So normally it's folks outside our agency who get kicked off of calls. I don't know what's happening with Google Meets today. It's having a snow day. So wouldn't that be nice? Yeah, so thank you all. Are there any other updates real quick before we close out this morning? Okay, well, hearing none, we're going to go ahead and close everything up. The recording will be posted as soon as Google works its magic on the back end, and we're able to get that posted. Thank you all for coming this morning. Special thanks to Fred and Friends for providing an excellent presentation. Just as always, if anybody wants to present at the next meeting, please, email me or Beth. We'll get you on the agenda, get you scheduled. I'd really like to continue this series and continue kind of learning a little bit more about some of the different programs and facilities. It's been really good to have some folks from the health department, some folks from the L&B, LBHA, other agencies as well. Really just kind of looking at what's available in our community so that we can be better informed to really provide those connections and that the systems of care that we need in Garrett County. So thank you all and have a wonderful, hopefully not too chilly